Directorate and all the facilities within the district. We want to thank Honorable Dr. Abed for the kind gesture, the motorbike that he has donated unto us today. He has already said it all. It is just to make health service accessible to the doorsteps of the people. Some of the areas, vehicles and others cannot move in there, and so this is there to ensure that. And currently, we know that Bunkpurugu is one of the seriously deprived in this region, and so this one comes to at least help us to improve upon the living conditions of the people. Because I see that when we're able to assess the people, deliver the quality health services, and the people don't fall sick most of the time, they'll be saving much more money. So I think that we actually owe him a big thanks. And this is not the only thing that he has done. Last year, he supported us to operationalize Bunkpurugu chips through CRS, his lobbying skills and other things. And then the water project was part of it, and we are all seeing it. And then as of now, he went through national and other things. So National Malaria Control focal person called me and said the Honorable has requested for some mosquito nets, and then if they want to go through a process to discharge it, to take a long time. So if we have the quantities, we could release and later they will replace. And so when I checked in my stores, I knew we could do that. So we spoke and I said, Honorable, we can do that. And so the nets is also here for maybe GES. So apart from that, Bunkpurugu, the indigenous of the land, probably we need to be much more united to see how we can put the health agenda through. When I came here 2018, the labor, the maternity block that was constructed by Japan International Corporation, Japan Embassy, it was vandalized, nothing was there. I made follow-up, I wrote proposals, it got to them, and they got back to me that I should link out with Assembly. If they're able to fix it and put it into good use, then they will come back. Whatever support we need, they will come back. I know the Japan, they are part of the UN agencies, and they share information. As and now when you go to Bunkpurugu-Nakpanduri, there are a lot of NGOs there. Bunkpurugu, there's no single NGO. So we are waiting and sitting and waiting for only IGF. And you know, Honorable, 2 years ago, health insurance, they were owing us for whatever it is. Honorable have to go to Accra, push it through, and then they have to pay. As of now, they are owing us 11, 12, whatever month, they are paying us 2 months. You know, we even spoke about that. And the Bunkpurugu Health Center that have been in the social media, Bunkpurugu Health Center shut down, no drugs, whatever. It attracted a national security. And national security was dealing with me. I have to write a report to regional director. When I took over the administration of the district, we were owing so much. And as of now, in terms of proper debt management in this district, Bunkpurugu is the best. The least owing at the regional medical stores. But here's the case: health insurance is owing you much. They pay you 2 months, and you have to pay 70% to defray your debts. How much? So there's a lot of, and when they bring the drugs, the component you have even requested is not even enough. And then you have to wait for the next 3 months. And those days, what happens is that when you request for the drugs at the regional medical stores and you go, the quantity they can't get for you, they give you certificate to go outside and buy. And so if they don't give the certificate, and then I will not want to go outside and buy, and tomorrow they drag me to public accountant. So sometimes we have other issues, and so the challenges are there. And I think that we as indigenous of the land, we need to team up and see how. And the Bunkpurugu Health Center, it was constructed sometime 1970 something. It has never seen any major renovations, and so the whole structure, when you enter there, you realize that it needs a lot of facelift. So please. Yes, the challenges are there, and we wish we could handle it, but sometimes your hands are tied. So let's all support our honorable MP, what he can do, and then all of us we can put pieces together and see how we can push the health agenda through. So I want to thank Honorable so much. As he said, there are plans far advanced to construct some weighing centers across the district, also to enhance the service delivery that we do. And all these things, we actually appreciate you, Honorable, and then God be with you and guide you to your steps. Whatever on your heart, God should grant it for you. And then for me, whatever assistance or whatever it is that we can do together to push the agenda, I'm always ready. Thank you so much. And I wish center had been constructed I think 1970s. It has never seen a major maintenance or renovations, and I don't even have the quantum of money. And even if I have the quantum of money that will go into I'm not qualified to issue that contract. I think my quota to give a contract is about 100,000. So, and that building that is standing there, if you want to give it to a contract, I believe 400,000-500,000 it will be. So it's above our level, and so that one too can be looked at. And then this erratic and inadequate supply of drugs and other things also is quite a challenge that I think that we also need to look at. And Bunkpurugu, people. Sometimes, as of now, the number of people who come to me and they are weeping, they are crying, they need a release back to other places is so much. Sometimes they come to my office and they are crying, they want to move. Why, and so I think that
what are the reasons?
If the road can be constructed to link up so that traveling hours can reduce, and I'm very sure that I can enter public means, go to Tamale and come back in 4 or 5 hours and do my things and come back. It makes a lot of sense. People who accept persons, people who can travel from Bunkpurugu in the public means within 4 or 5 hours. He's in Kumasi, the following day is back. But I tell you, as I now we stand, it takes you a whole day to travel to Tamale, even Tamale, to come back in public means. So that is also another area that we can look at. So these are the 3 issues. If you want to ask me, human resource can also be looked at. And then transport like Honorable is supporting. As of now, we still need a lot of transport to enhance the service delivery. And so,
he was talking about